Good morning and welcome to my update for June 26th. We're going to be looking at the western U.S. states, essentially the states west of the Rockies today, to take a look at daily case progressions. This slide here is from the California State Health Department, and it is showing daily new cases with the trend line for a 14-day average, and then overlaid in the back, the jagged line you can see is the daily case numbers for each individual day. So this is of concern because you can see that the trend line for the daily new cases has taken a sharp turn up. I can perhaps pick out 3 different trend lines there, where when they were being very strict about the lockdown, they were being able to slow the increase of new cases or the spread in the population. But as they eased the lockdown, as the protests began, as large groups of people gathered together, not necessarily respecting social distancing, many of them without masks, many of them shouting and yelling, you can see that what had been a smaller uptick in the acceleration turned into a larger uptick in the acceleration, and that date there is about June 13th, which would be what you would expect to see about 2 weeks after some major gatherings of people. You're going to see some additional positive cases. So not good news for California. I think Governor Newsom's done a good job by mandating wearing of masks in public spaces. I haven't seen any information on how well that's being observed or enforced. Hopefully what's happening is that the businesses themselves are reinforcing that by not allowing people in without a mask. I know that in San Francisco when I was there, that was the case for Starbucks and many of the other places. You just simply couldn't come in the business unless you were wearing a mask, and I think that's the way to solve it. This slide then is Oregon. On some of the slides from the state health departments, you'll notice that there's a decline at the end. That's just simply a lag in the reporting that's coming through. So, and thanks to them, they actually identify that with the green-ish shaded area to show us what's going on there. You can see that Oregon definitely had an upward trend even before the mass protests that went on in Portland and in other places, but that trend definitely continues. They had been doing such a nice job of beating it down, but effectively, if you follow that same rule that you're looking about 2 weeks ahead, then you're seeing something was going on in Oregon mid-May, early May, that allowed this spread to happen, either relaxing of the conditions of their lockdown, or perhaps just the population getting bored with it and not being willing to follow it. We do know that in many of these states that are seeing resurgence or their first real true epidemic outbreaks, that many of the cases are happening among the younger set of the population who feel somewhat invulnerable to the disease. The problem with that is that then they go to the Memorial Day barbecue with grandma and pass it along to them because they're not wearing masks or social distancing there either, and that's a difficult thing. We're only at the beginning of this. I think that's something to remember too. This isn't the end. This is the beginning. There's not nearly enough of the population infected yet to create any sort or any significant herd immunity. Here we have Washington State, and Washington State, you can see, was trending downward until about mid-May, but then it does seem like we've got a pretty steady upward increase. I can't tell you that there's anything that has changed significantly. I'd need to go in and look at the daily data and apply some limits in order to see if I could really nail down a date for when things changed. But as it stands right now, suffice to say that Washington, having been one of the initial hotspots in the country, brought it pretty well under control and was doing a good job, but something's changed in their they're on the increase again now, which is unfortunate. This is the state of Idaho. They also were a state that had one of the initial outbreaks, similar to Seattle in Washington, where travelers from overseas were at a resort community in central Idaho, and that's what that first upsweep is. The following one, I can only attribute to the opening up and the fact that people tend to wear masks in Idaho. It really seems like it's coming down to the people that wear the masks are the ones that are worried about their own health. And what it needs to come down to is everybody needs to wear a mask to protect everybody's health. We need to work together on this. The United States is a very individualistic society. We value our personal freedoms, but at the same time, the good of the public is something to look at, especially when it's science. When it's something so obviously needful. So Idaho, if you just look at the cumulative case count, you can definitely see that about June 15th, there was an upswing. And right now we're on a chart like that. And so that's not good. Now, cumulative number of cases in Idaho is 5,000. So nothing compared to some of what these other states are seeing. But it's going to come if we're not more careful. What Idaho has in its favor is that we are very spread out. It's a large state with very few people, and that helps. So social distancing is natural. It's easy to spend your day without contacting anybody. Easy, really. Now we go to Utah, and you can also see in Utah that you've got a pretty good divider between what was going on during the lockdown, and I imagine that that's what we're seeing here, is that as lockdown eased, we started to see cases climb. I don't necessarily see in this data an effect from the protests that happened in Salt Lake City, although I'm sure that some of these cases did emanate from there. If you were to see that, I would have thought that we would see something more like that and then like that. And I'm not sure that I can read that into the data. I'd have to take a look at the individual numbers. And I'm working on getting something together to be able to do that with a little bit more control for you. And this is Arizona, and Arizona's been the hot spot that's been in the news. Again, the county that is highlighted in red is the county that where Phoenix is. So it's the largest population center. And you can see that Arizona, truth be told, it looks to me like Arizona really didn't mitigate hardly at all, because their cases per day has increased. And I think what you're seeing there is that dissemination thing that I've talked about, where it's taken a while for the epidemic to get into the far-flung areas, both of the world and of the country. And so, prior to, say, May 20th, 25th, it hadn't really started to take off. But, Memorial Day weekend is probably that slope there. And I would say probably the protests are that slope there, if I were to read anything into this. But yeah, Arizona's got a pretty significant problem here, and hopefully people are going to get serious about it. I have friends who are sick there, and I'm worried about them, and I wish that it would be nice if people would get concerned enough about it to wear their masks in public spaces, as if they had already gone through what New York and New Jersey and Connecticut went through. But I guess we all have to learn our lessons, each in turn. So that's my update for today. If you liked it, please subscribe. I thank you for watching, and it's encouraging when I see that there are people that are getting something out of my videos. And as always, wash your hands with soap and water. Use hand sanitizer if you don't have soap and water. Wear a face covering in public spaces. Don't wear it just over your mouth. Wear it over your mouth and your nose. Try to avoid touching your face. And please tell your friends and loved ones to do the same. And if they say, I'm not going to get sick, tell them you're not doing it for you. You're doing it for everybody else. You're doing it for anybody that you care about. And there are people that I care about who are sick and have been sick. And it's not a funny thing. It's not a thing that you should be being selfish about. You should really pay attention to this. So thanks again. I appreciate your support.